Mr. RCrowder. And of course, Ms. Diddy, before we had our first commercial break, we were talking about some aspects of AIDS and HIV. But in order to continue our discussion, let's talk about some statistical information dealing with AIDS. I think one of the reasons for the show was the alarm that was sent out quite recently by the Congressional Black Caucus of the impact that this thing is having on African Americans and whatnot. And of course, we also mentioned minorities and et cetera. But give us some statistical information, as much as you and Mr. Crowder would care to give, relative to this disease, so that we can have some idea, some understanding of the real impact that this disease is having.
Okay, Dr. Haney, here in Tennessee, we currently have over 9,000 cases of HIV. Now, African Americans, I believe, comprise approximately 26% of the population in Tennessee, yet we comprise over 55% of those cases of HIV, which is, you know, indicative of some things that are happening with, you know, some of our behaviors and attitudes regarding the disease and the risk that we're either at or that we're not at risk. Worldwide, there are almost 9 million cases, and most of that is in sub-Saharan Africa and other developing countries. When you think about issues pertaining to women with AIDS, it's nearly 80% of the women who are infected are African American and Latino. Now, we only comprise about, I would say, 25%. If you merge those two cultures, only 25% of the female population, but nearly 80% of the AIDS cases.
Well, now, how is it, and of course I know that all of these things have a lot to do with health and other things, but how is it that in so many instances we say that that there's a tremendous health problem dealing with African Americans in Tennessee? I think kidney disease is another one of those problems, where we make up only a very, very small percentage of the population, 25, 30% of the population, yet we have 55 or 60% of the disease. And it seems that not only is that true in terms of AIDS, but that's also true in terms of kidney disease. It's true in all other chronic disease. Now, is there some kind of correlation or some kind of connection with that? I mean, what do you see as a connection with that?
One of the things has just been our access to health services. We sometimes, unfortunately, have been very crisis-oriented. And so if it's not pain-related, if it's not hurting, if I don't look sick or feel sick, I'm not going to go in to deal with, you know, the medical intervention. And that even impacts on our whole issue of testing.
Right.
What would you say about the testing?
And it's the same thing with HIV and AIDS. You know, the fact that a person doesn't look sick, feel sick, you know, we as African Americans, we've only ever went to seek health care, not as a preventive method, but as we got sick. And, you know, we just grow up that way. You know, in my time, the only time you ever went to the hospital was when you were sick. And that is embedded in us as African Americans. And that's how it is now. People go on site. If this person look good, they look like Arnold Schwarzenegger or Sophia Loren, you know, and that's all they go on. That's why the disease is so treacherous and having such a major impact in our community. For one thing, people are not seeking testing because for some reason or another they feel that they're not at risk. They're not, this is my next door neighbor's problem, this is their problem, it's not my problem. And you know, like people tell me all the time, you don't look sick, and I try to explain to them, what does a person with AIDS look like? And that's been portrayed on TV, that he's gonna be extremely skinny, real sickly looking, and that's the way that's the picture that they portray.
Well, would you say, Mr. Crowder, though, that over the last many years, and I think we mentioned earlier that one of the first interviews that we had dealing with this disease was with the founder of the organization that you're with now, Dr. Poku, who was at that time the director of COPE. And I think that one of the things is that people have a fear really of finding out about some of the things, some of the calamities that they think that they might befall them, and so they don't pay any attention to it, or they try to simply stick their heads in the sand. Is that what we're saying?
Yeah, exactly. And again, I like to stress that now it's not like it would. This is 98. This ain't 88. And now they have better treatments. People are living longer. Disease progression is at a slower rate. As a matter of fact, what this year is the first year we've seen a drop in AIDS-related deaths. Now that's not to say that new infection rates are not going up, but AIDS-related deaths in and of itself is decreasing. That's because people are living longer with the disease. And now they have great testing. They can test now to see exactly where you are in the stage of the disease. That's with the viral load testing. They've even came up with 2 tests out of the Geneva meeting that they can even test now which drugs are becoming resistant to the virus and causing it to replicate and mutate. So now they're doing great work, you know. So it's best that a person know their status, and it's best that they seek treatment and have a very good working relationship with the physician.
But you know, that also has a relationship to our community's attitude about HIV and AIDS. And in the African American community, well, in the United States, in and of itself, when AIDS first became known and an epidemic, it was initially associated with gay white males. Then that was West Coast. And the East Coast, it was IV drug users. So the stigma of being in any of those populations is enough to bring shame and guilt and all kinds of negative feelings. And when the community responds in that way, oh, the person got what they deserve, oh, their behavior made them, oh, some are innocent, some are guilty, then it makes it less likely for a person to come forward as courageously as Ron has to educate others, to let the community know that, you know, we're here and looking like you and me and everybody else, but yet you have to be more compassionate as a community and supportive. And so many of the, I think, people who may be walking around infected, who have never been tested, don't want to deal with the subsequent emotional baggage that may come with having a diagnosis of positive because of the stigma.
And one other thing with that is, and what that does is, and what's happening is, people in Africa.
Let me interrupt here, and of course we're going to have to take this break, and we'll be back with you following this short commercial break. I shouldn't have let you break in there. We're talking to Ms. Sheila Denny, and